Hello, everybody, welcome back. Thank you for tuning in once more to your favorite station 14.05. My name is Jose Rodrigo, and today we are going to talk about a very common disease. I'm talking about the influenza. Influenza is a viral infection that affects your respiratory system. In concrete, it affects your nose, throat, and lungs. Now, if you may suffer from the flu, what symptoms can you identify? Well, you can have cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue. That's the main symptoms. Now, if we are talking about signs, we can have fever or feeling very chills, as well as in some cases vomiting and diarrhea. But before continuing with this explanation, before continuing, we go to a little commercial break. Hello, we are back. We continue where we left. Now we are going to talk about how the influenza is transmitted. Well, people with influenza can spread it to others up to about 6 feet away. Most experts think that influenza virus spread mainly by droplets made when people with influenza cough, sneeze, or talk. These droplets can land in the mouth or noses of people who are nearby or possibly be inhaled into the lungs. According to the Center of Disease Control and Prevention, the people that are in a high risk of developing influenza or having related complications related to influenza are children younger than 5, but in specific children younger than 2 years old. Also, adults of 65 years of age and older, pregnant women, and women up to 2 weeks of postpartum. Now, let me talk about if you don't want to get the influenza virus, there are various things that you have to, there are various things you need to know. Influenza virus circulates year round. Most of the time, these peaks are between December and February, but the activity of this virus can last as late as May. However, you can prevent this by washing your hands regularly, avoiding large crowds, especially when there is this outbreak, covering your mouth and nose when you cough or sneeze, as well as staying in your home if you develop a fever and for at least 24 hours after it goes away. Now, if you have contract this disease, the treatments you should have or the doctor would reset you in a prescription are over-the-counter anti-inflammatory pain relievers that can help with the symptoms, as well as if you have an annual vaccine, you can prevent the flu or influenza and limit its complications in your life. But if this doesn't happen, doctors may recommend you a fluid replacement and and as well they will give you medications. And last but not least, with this COVID outbreak, many people may confuse with with COVID and influenza because they are the same. They can result in the same in a little complication the same. They can be the same, but they are not. But both COVID and the influenza may or can result in a complications including pneumonia, a respiratory failure, acute respiratory distress syndrome, and as well fluid, and as well you can get fluid in your lungs. So my recommendation is if you think you have the flu, you say maybe I don't have COVID, but it's the flu, but you don't know. So my recommendation is go to the doctor, get some treatments, and in there the doctor will give you a prescription. And if you have the influenza or COVID, don't visit people because if you do this, you will spread the virus. And thank God, no, I think doesn't happen to your family. You may lose a familiar if you result you have COVID-19. So my recommendation is you feel bad, you think, man, it's probably a flu or influenza. I recommend you go out to the doctor so it can give you a prescription. So in order you don't spread the virus around with your families or other people. Well, that could be all for today. Thank you for tuning in once more to your favorite station, the 14.05, with your favorite host, Rodrigo. The next time we tune out, we will be talking about pneumonia. Thank you and have a good day.
And don't forget, you were listening to the 14.05, the station that cares about your health and doesn't leave you to die.